Hello, everyone. My name is Lizzie, and I'm a health coach for Corporate Health Partners. And today we're going to talk about balancing blood sugar. It's really looking at prediabetes and diabetes prevention. So let's get started. Here are the topics that we're going to cover today during this virtual presentation. The first thing we're going to look at is just quickly at statistics of diabetes and prediabetes in the United States. Then we're going to give you a chance to take a quick kind of screening tool that evaluates your risk of prediabetes. We're going to look at blood tests and kind of break down what those mean. We're going to talk a lot about prevention and what steps we can take to really help prevent diabetes and prediabetes. We're going to look at carbohydrates, kind of breaking down what those are and how those affect blood sugar. And then we're going to look at how to balance blood sugar with lifestyle changes. So the first thing we want to make a quick note of, and the reason why we want to emphasize and give you guys this information about diabetes and prediabetes, is that it's pretty prevalent in the United States. You can see on the left-hand side for diabetes, there's 29.1 million American adults that have diabetes. That's about 1 out of every 11 people. And the slightly scary factor that's on here is 1 out of 4 people don't know they have diabetes. And we want to make sure that people have the education and know their numbers and make sure they're going to their doctor to ask questions so we can really help manage this if someone does have diabetes. On the right-hand side, you can see the statistics for prediabetes. So 86 million Americans, or 1 out of 3 adults, have prediabetes. So you can see in comparison to diabetes, that's quite a bit higher. 9 out of 10 people don't know they have this. So part of the reason why our yearly screenings that we do with you all are so important is that it does let you have those numbers that you get to go over with your health coach that really help you identify maybe there's some lifestyle factors I need to change to really help reduce my risk and kind of get out of that pre-diabetic range. So if you click on the picture that says, "Could you have prediabetes?" that's going to take you to a YouTube link. It's a quick video that just really helps evaluate your risk of prediabetes. So make sure you do take that when you get a chance, maybe not right this second, but you come back to this slide and click on that. It just, again, is such a great way to just kind of quickly evaluate what your risk of prediabetes is if you don't know already. If for some reason the link doesn't work, you can also just type it into your web browser. You go to www.doihaveprediabetes.com, and that should let you kind of click on that risk test as well. So next we're going to talk about glucose or blood sugar. We get a lot of questions in coaching about what this is. I know you hear a lot of different numbers from us, especially after the screening, so we want to take a second to kind of break down what this is. So glucose really just means sugar. Okay, so blood glucose, blood sugar, glucose, they're all effectively the same thing. You can see in the image below, it kind of breaks down the process of how we use our food and glucose in the bloodstream. So number one, any food that we eat becomes glucose and that enters our bloodstream. Okay, so this is any food we eat, not just carbohydrates. Blood glucose levels go up anytime that we eat something. Insulin, which is a hormone made by the pancreas, and we'll talk here about a little bit more about just a second, acts as a key to really help unlock those cells and let the glucose in. Glucose then leaves the bloodstream and enters your cells, and blood glucose returns to normal. Okay, so this is a really important process because cells turn glucose into energy, and energy is obviously the things that we need to keep us going during the day. So on the flip side, what's insulin? We kind of just mentioned that quickly in the slide before. So insulin is a hormone that's made in the pancreas. And remember that hormones are chemical messengers that talk to each other. So think about like they're walkie-talkies of the body. You may have heard of other ones like estrogen, testosterone, cortisol. Those are all hormones. And what insulin does is it helps the body use sugar for energy. It lowers the blood sugar by moving sugar out of the bloodstream into the cells. So we just saw that in the slide before. Insulin is this kind of like the key to the cell that lets the glucose enter, and then the cells use that for energy. You cannot live without insulin. Okay, you have to have insulin in order to make all of this process work. When your body can't make enough insulin, you may take manufactured insulin using a shot. So if you've ever known anyone that's had to take insulin shots before, that's why. And you can see on the picture on the left that this kind of breaks down that process. The main test when we're really looking at blood sugar is A1C and then a fasting blood sugar. So usually that's why we have you make sure you have nothing to eat or drink about 8 to 12 hours before we take these tests, because it gives us just a better idea of what your blood sugar runs normally. So if you think back to your screening, do you remember what your results were? Hopefully your coach went over these and they discussed the healthy ranges, the pre-diabetic ranges, and the diabetes ranges if there was an issue for you. The healthy range for glucose is less than 100. That's kind of where we want it to fall to make sure that there's no risk of prediabetes or diabetes. You can see on this image that's on the right-hand side, you can see what we're kind of looking for in terms of an A1C or blood sugar if you fall within the prediabetes or diabetes ranges. For prediabetes, if your A1C is between 5.7 to 6.4%, or if your blood sugar is 100 to 125, that puts you in that pre-diabetes range. If you're within the diabetic range, your A1C is a 6.5 or above, and your glucose is 126 or above. Okay, so that's kind of what we're looking for when we evaluate your lab results. And you may have, if you fell within one of these, gotten one of our physician referrals. Okay, and remember those physician referrals are really important to make sure that we're getting that additional attention from a doctor who can really help you manage some of these or keep an extra eye on what your blood sugar has been doing. You may be thinking, how does this A1C test work? Okay, we know that A1C is more like a 3-month video of what your blood sugar has been doing, whereas glucose is more of a snapshot of within 24 hours, what has my blood sugar been doing? So they're a little bit different tests. And I get a lot of questions when I do coaching about, well, how does the A1C measure that? Okay, how does that work exactly? So, like we said, it's a result of the past 2 to 3 months, and it is like a movie. So, it gives us that long term kind of overview. A1C measures what percentage of your hemoglobin. So, hemoglobin is a protein in red blood cells that carries oxygen, and it's coated with sugar. Okay, so the higher your A1C level, the poorer your blood sugar control and the higher your risk of diabetes and complications. Okay, so you can kind of see here on this image, glucose in the body sticks to hemoglobin A. Glucose remains stuck to hemoglobin A for up to 120 days, and then the test measures that percentage, is what it's looking at. A1C, now your screenings is automatically taken for anyone with a glucose level over 120. So, this automatically gets an A1C test because we want to know if that was a kind of a random high glucose reading. Maybe you accidentally ate something the day of the screening and forgot. Or is it something more that we really need to look into? Does it mean that maybe you have a higher risk of diabetes? This test is also really important. It helps us identify your risk of prediabetes. If you obviously have a risk of, or if you have higher glucose readings, it means that maybe you have a higher risk of developing diabetes. It helps us diagnose type 1 and type 2 diabetes. Obviously, to confirm a diagnosis, that's more what your doctor does, which is why we give you that physician referral process. You can go to your doctor and have that further conversation with them. Another thing that the A1C test does is that if you are an already diagnosed diabetic, it helps really monitor your treatment plan. Okay, so it helps us get that baseline, and then what do we need to do to maybe adjust what we're doing to help manage that better? So we want to take just a second to differentiate between prediabetes and type 2 diabetes because they are different, and there's a couple different things that kind of separate them. So the first thing about prediabetes is it is a precursor to type 2 diabetes. In almost all cases, people do spend quite a bit of time as pre-diabetics. And what this means is their blood sugar levels are higher than normal, but they're not quite high enough to be diagnosed as diabetics. We just saw that in a couple slides back when we were looking at the blood sugar tests. Another really important thing about prediabetes is that if action is taken during this stage, you can delay or prevent type 2 diabetes, meaning it's reversible. Okay, so it's not quite to the point of diabetes where it takes a lot more to manage it. This is a stage we really want to catch people so we can really help prevent the onset of full-blown diabetes. So now looking at type 2 diabetes and why it's different than prediabetes is this is a more chronic condition. So type 2 diabetes means insulin resistant. So for some reason, our body is not able to really use that energy or sugar in your body. The insulin's not allowing the glucose to enter the cells, or the cells are not really using that energy properly. It is influenced by lifestyle, meaning type 2 diabetics are often overweight and not as active. The therapy for this is lifestyle changes. So, really working on your nutrition habits, being more active, sleep, stress levels, right? All of those sorts of things. And medication that's prescribed by your doctor. It generally occurs in adults over 40. Not always, not in every single case, but this is very typical for this type 2 diabetes. And roughly 95% of diabetics are within this type 2 diabetes category. So, what causes glucose to change? What makes it go up? What makes it go down? So, things that raise blood glucose, food, particularly carbohydrates. We're going to talk more about that here in a minute, but we just saw the reason why that does that. Illness is a big one too. So, sometimes when you're sick or you're not feeling well, this is going to cause glucose to go up. Stress is a big one. I know that's something we focus on quite a bit in this wellness program is making sure we have really healthy ways to manage our stress for lots of reasons, but blood sugar is one of those. And then medications, cortisone, steroids, all of those things really make blood glucose go up as well. Now, on the flip side, what are some things that lower blood glucose? Well, exercise is a big one. Moving muscle, lower glucose. Okay, that's kind of something to keep in mind. So the muscles obviously use this glucose when they're working out or they're exercising, and it really helps get some of that extra glucose out of the bloodstream. Weight loss, stress management, and medications like metformin or insulin injections also really help lower blood glucose as well. And those are obviously things that are prescribed by a doctor. So maybe you took that quiz earlier that we offered in one of the earlier slides and you're found that you're maybe at a higher risk of prediabetes, or maybe you're already healthy. You just want to make sure that you're staying on top of it. What kind of things can you do to really help with this? The first thing is to set goals with your health coach. That's why we're here. We're here to really help you and keep you accountable. So definitely take that time when you're meeting with your health coach to make sure you're setting appropriate goals for yourself. Next thing is to follow basic nutrition guidelines, which we'll talk about here in a minute. That includes reading food labels and eating small meals and snacks every 3 to 4 hours. We also want to make sure you know your numbers, okay? Not just your glucose and A1C numbers, but there's other ones that we'll talk about here in a minute as well. And staying active is a huge part of it as well. So, part of following basic nutrition guidelines is kind of understanding macronutrients. Macronutrients is really just a fancy term that talks about the 3 different kind of nutrients our body needs in order to really function correctly and make sure that they're all included in our diet to give our body all of the nutrients it needs. So hopefully you know this, but there's 3 types. There's carbohydrates, there's proteins, and there's fats. Okay, keep in mind that all 3 of these are really essential for a complete and healthy diet, and each one provides different energy and materials for the body to really function. Proper ratios of these are really helpful when we're thinking about a healthy diet. So we do want to make sure that we're getting a little bit of carbohydrates, proteins, and fats at each of our meal. You can see here that some of them overlap. Some are considered carbohydrates and proteins, and some are considered proteins as well as fats. And we'll kind of jump into carbohydrates specifically because that's one that we really want to watch because it affects blood sugar the most. So, what are carbohydrates? I get asked this a lot during coaching, and I'm sure other coaches do as well because there's been a lot of confusion about carbohydrates. There's some surprising things like milk and yogurt that are included in the carbohydrate group that not a lot of people know. And the other part of it is that recently carbs have gotten a bad reputation. Diets such as like Atkins, the keto diet, cut significantly back on those or cut them out completely. So we just want to make sure that we clear the air. So carbohydrates are found in a variety of foods. You can see on the right-hand side, there's lots of different types of foods listed like starches, bread, cereal, pasta, fruit, milk, yogurt, beans. starchy vegetables like peas, corns, and potatoes, and of course, sugary foods. But they are the body's main source of energy. So when you eat them, carbohydrates get metabolized and turn into glucose or sugar within about 90 minutes, so pretty quickly. Carbohydrates are a really important nutrient to monitor when you do have diabetes or prediabetes because these are the ones that increase blood sugars the most. So, for a person with diabetes or prediabetes, it's really recommended that we eat a consistent modified carbohydrate diet, which we'll talk about here in a minute. So, this slide kind of overviews, are carbs evil or healthy? Okay, and that's a lot of people's mindset, trying to figure out and weed through the lots of information that's online about carbohydrates. So, we're here to kind of break it down. So, the biggest thing to keep in mind when you're thinking about carbohydrates is that they can be both good and bad, okay? And I hate to use those terms because there's no such thing as good or bad foods. But when we really think about the type of carbohydrates we're eating, that's what we want to focus on. Okay, so you can see in the picture that's on the slide, whole grains on the left-hand side are the ones that we want to choose more often. Whole grains are more of the healthy types of carbs we want to eat because they contain more nutrients in them, also more fiber. Fiber is one of those things that really helps balance out your blood sugar when it's eaten because it takes the body a lot longer to break it down. Therefore, the glucose is being released a lot slower. You can see on the right hand side are more of the refined grains. Okay, those are the ones we want to choose less often, but it doesn't mean you have to cut them out completely. So, white bread, white rice, fine wheat flour, those are all types of ones that we can still eat. We want to make sure we're having more often the whole grain versions of those. Here's another kind of breakdown of complex carbs versus simple carbs. So, examples of the healthier versions and maybe the not so healthy ones, the ones we want to enjoy more often, and the ones we want to limit. That's the way we got to think about it. So, on the top, you can see the complex carbs is the whole wheat bread, the sweet potato, the berries, the oatmeal, the bananas, right? The fruits and vegetables. Those are the ones that have more nutrients, vitamins, fiber, water. Again, help keep the blood sugar nice and stable in the body. The ones on the bottom, the simple carbs, we want to enjoy very much in moderation. Okay, so those are the things like your candy, your french fries, right? Your cookies, your sweets. Anything that has those added sugars to them are the ones that we want to limit and make sure we're just taking easy on. Here are a few other basic nutrition guidelines. So, things to keep in mind. So, we want to eat about 3 to 5 smaller meals and snacks throughout the day. This helps us really kind of boost metabolism and reduce hunger. Okay, if you space them out about every 3 to 4 hours, that helps prevent those long breaks that you go between eating. And what happens when we do that, right? If you go too long without eating, you get really hungry, ravenous, right? And it makes it a lot harder for you to control your appetite and your cravings. Another part of that, and what this helps kind of cut back on, is those large meals that you may be consuming. Large meals increase your glycemic load, and all that means is it keeps your blood glucose elevated for longer periods of time. We want to avoid doing that because obviously the whole point of reducing our risk of prediabetes and diabetes is lowering our blood sugar levels in our bloodstream. Something we just talked about, limiting sugar and refined foods and also choosing fiber rich foods. And then you also want to limit your saturated and trans fats. This really helps with maintaining a healthy weight, okay, and that dramatically improves your glucose readings. We also want to watch alcohol. Alcohol is one of those things that actually significantly raises blood sugar. So, of course, we want to just be careful on how much of those and the types of things that we're drinking. Something we discussed before and earlier in this presentation was knowing your numbers. So, A1C and glucose, of course, are important, but there's a couple other things that we really want to make sure we're monitoring just to help prevent prediabetes. First thing is blood pressure. That's something we check at every single coaching session. So make sure that you're going to your appointments, meeting with your coach, making sure that you're checking this to just monitor it. It's not getting out of control. The other thing is weight. That's something we check at every coaching session as well. And again, it's just that nice check in to make sure it's not going up steadily. We're watching it. We're finding ways to really change our habits to monitor our weight and get to or maintain a healthy weight. If losing weight or maintaining a healthy weight is one of your goals, you're probably talking about a lot of these like kind of weight management tips with your coach already, but just a great reminder of some things that we can do. So first thing is to avoid skipping meals. When we skip meals, it kind of goes back to that we get overly hungry and then we have less control over the healthy choices that we make. So definitely make sure you're not skipping meals. Eat slowly, chew your food well. That helps us slow down our feelings of fullness so we stop when we're full rather than getting over full. Use smaller plates to help control portions. The American plates have grown in size over the years, so kind of getting back to a normal 9-inch plate or even smaller. Maybe it's just one of your smaller side dishes that you're using to eat off of. That helps as well. Something that goes along with that is if you're packing your lunch to take it with you to work, you can use pre portioned kind of plastic containers or glass containers to help with this as well. Weighing yourself regularly and tracking your weight, that's something we do in coaching, but maybe you do that at home as well. And then balance your calories. So if you're less active, eat fewer calories, right? That kind of helps with that weight management. On the healthier choices side, we've already discussed a lot of these, but choosing high fiber foods, eating healthier oils like olive oil, canola oil, other plant based oils instead of butter helps. Choose options with less sugar or no added sugar. So, really reading the food labels and seeing how much added sugar is being put into a product. And then cook with healthier methods like stir fry instead of deep fry. Those all are great ways to kind of keep, or great tips to keep in mind for weight management. Another important way to monitor your blood sugar levels and also maintaining a healthy weight or just staying healthy in general is to stay active. Okay, this is something we talk about a lot because movement is key. So, a couple things if maybe you don't have time to do the recommended 30 minutes a day of exercise at a time, there's lots of other things that you can do. Working in a garden as a family gets you to spend time together, get some good exercise in. It's a great mental break as well from your work day. Taking the stairs at work or at the grocery store or anytime that you're out, definitely taking the stairs is a great way to get those extra steps in. And then another great thing is that walking around the field while my child is at soccer practice. So instead of sitting there on the sidelines, which is not a bad thing to do either, but spending some of your time walking around. There's lots of space to do it and taking advantage of those small moments where you maybe have an opportunity to be more active. Last thing, early detection is key. So if you're worried about prediabetes or diabetes, maybe your numbers this year were not really what you were expecting or wanting to see, then this is kind of a big thing for you to pay attention to. So obviously, attending the yearly health screening that we hold to find your glucose and A1C numbers. Know what your numbers are and what they mean. Okay, so ask questions. Ask your doctor, ask your health coach, ask them about what they mean so you really understand it, and that way you can really take control of making a change. Take the self test, including this presentation, to give yourself a better idea of maybe what some of your risk factors are. And then, of course, talk to your health coach about goal setting and lifestyle changes. Again, this is why we're here. We love what we do, and we're more than happy to help you kind of reach a goal to help prevent prediabetes and diabetes. There are a few other exams that you may want to consider if you are a diabetic, if you've been diagnosed with diabetes. So we're going to kind of just cover those briefly and just go through a couple additional exams that we want to make sure that you're staying on top of. The first one is eye exams. So obviously for everyone, it's really important to take care of your eyes, but this is especially true if you are diabetic. It's recommended that we really want to make sure we have the eyes dilated once a year and share those results with your primary doctor. Your primary doctor kind of keeps track of all of this information and it just goes into your kind of overall health. So they want to make sure that we're staying on top of those. Definitely contact your doctor right away if any of the following below are true. So if you see little black spots that don't go away, red spots or red fog, sudden change in how clearly you see, or it takes longer to adjust to darkness. These could all indicate something a little bit more serious, and so we want to make sure that if you do have any of these symptoms, you are calling your doctor so they can kind of guide you to the next step to really make sure that we're preventing some of these more serious issues that can occur. Another really important thing, again, that's for everyone, but specifically for diabetics, is making sure you get your dental exam. So, diabetes is associated with gum disease or periodontal disease, if you ever heard of that before. And treatment of gum disease can lower your blood sugar. It's recommended that we have a dental cleaning every 6 months, so just make sure that you're staying on top of that. Right now, that might be a little more tricky with COVID. Some dental offices have not opened yet, or they're limiting the number of people. So just make sure that you're reaching out to them to kind of figure out what the next steps are. The last exam that we're going to really take a look at is your feet exam. So the reason that this is so important for diabetics is that it can reduce the blood flow to your feet, and this can cause numbness, sores, or calluses. You might be thinking, I already have some of that, okay? And this is why it's so important to make sure that we're taking a look at our feet. It is the main cause for loss of a toe, foot, or leg. You may know someone, or maybe someone in your family, who's had to have an amputation before because of this, and this is why, is because it can really cause some issues with blood flow. So we want to make sure that we're having a podiatrist, which is just a fancy name for a foot doctor, check your feet once per year. And then you yourself really want to make sure that you're checking your own feet every day for cuts, sores, blisters, or swelling. That's really important because a lot of times, too, with diabetes, if your blood sugar is running high, things aren't healing as quickly as they normally would. So, something like a simple cut could turn into something much bigger and then cause some of these other serious complications to occur if we're not really watching those. So, definitely checking yourself every day, and then make sure you're moisturizing your feet every day. Just be sure to not put it between your toes. That kind of wetness can cause an infection between your toes, so make sure you're rubbing it all over your feet and trying to avoid right between the toes. Once you get this information from your podiatrist, I would also let your primary care physician know. Again, it's really important that they have all of these information or all of these results from your different doctors. So that way, again, they can put it in your file, and it's just a good overview of health.
So here's the moment you've all been waiting for, your healthy credit question. To receive a healthy credit for this virtual healthy break, answer this question and text it to Coach Jordan or email it to her. The question is, name one way you can work on reducing your blood sugar. Or in other words, what is one thing that you can do to help manage your blood sugar?
Thank you guys so much for tuning in today and listening to this virtual healthy break. If you have any questions, please reach out to your health coach about any of this information, and they'd be more than happy to answer them. Thank you so much, and I hope you have a great day.